Good morning, this is Keisha Ashmead. I'm going to talk to you about how to start an intravenous peripheral line. First, you want to make sure you have the proper order, or either write the order for an IV access. You want to make sure you have the patient's allergy histories to any medication or to any material. You want to gather your equipment, make sure you have the right patient. Also, you want to explain what you're going to do to the patient. Also, the complications of starting an IV. You want to make sure you wash your hands. Part of the equipment is to get a tourniquet. You want to assess the patient's arms, just to see if you can visualize a vein. You can put on gloves. These don't have to be sterile, just clean gloves. And you want to make sure you clean the site. You just need alcohol to clean the site where you want to start the IV. Allow it to dry. It just takes a couple of seconds. And then what you're going to do, you go ahead. Once you find your vein, go ahead and access that vein by using the needle to insert into the vein, which is a venipuncture. You want to make sure you stabilize the arm because it does kind of hurt. And you don't want the patient to move. When you insert the needle or the catheter, you want to make sure you go at a 10 to 30 degree angle, and this depends on where the vein is and where it is in the arm and if the patient is moving. So once you get a flashback of blood in the little chamber of the catheter, you want to go ahead and pull out the needle, depending on the device you have, and insert or thread the catheter into the vein. You want to release the tourniquet, and then you want to go ahead and connect your equipment to the catheter that's in the vein to stop blood flow. So you can make it into an IV if you have fluid that you need to connect it to, or you can just make it into what we call as a saline lock, where you just flush the blood out of the catheter and tape it down or secure it down. Depending on if you want to just give medicines through, or if you're going to give some fluids or even give blood, you want to think about if you need to flush it with normal saline or sodium chloride. And also, you want to make sure you put a good dressing on it to secure it, like I talked about earlier, and also label it because it only stays in for a couple of days. You don't want it to stay in too long because it can increase infection. Now you want to discard your equipment into a sharps container. Remove your gloves and just document the site, the timing, and what you've done. And so that's it. Thank you for listening to this presentation.